Video to discuss health literacy and how it can be connected to how we deal with patient communication. So, to begin, a nice little professional definition of what health literacy is. I got it right here. It's the ability to obtain, read, understand, and use healthcare information in order to make appropriate health decisions and follow instructions for treatment. So, I watched several lectures, talks over the past few days about what health literacy is and what patient factors we need to consider when the next time we decide to communicate with our patients. And it really got me able to evaluate and reflect upon my own practice and how I communicate. Anyways, all in all, the history of health literacy and health literacy studies has improved over the years. So now studies really look at the person's ability to fully function. And it considers demands of workplace and society as well. So it's a big improvement for what it used to be. But there are also, when educators talk about health literacy, there are also 5 linked skills: reading, writing, speaking, listening, and working with numbers and mathematical concepts. And the two skills that we seem to not be attentive to in public health is speaking and listening. Ironic, because we're supposed to do those anyways. There seems to be a focus, or has been a focus, on looking at the individual deficits, what they're lacking, or what's the problem with the individual that I'm talking to, instead of focusing on, hey, how can I better the communication? What do I need to consider about the patient and all their background, so that I understand how I can better communicate for the patient, instead of blaming the patient for poor communication skills, or blaming the patient because they didn't follow instructions, they didn't even understand the instructions, oh my goodness, they don't get the patient handout that I gave them. Well, why? And we need to really focus on that why as clinicians. Two of the things we need to pay attention to, at least I do in my practice, is the handouts that I give my patients, and my communication skills. And with communication skills, it's both written and verbal communication skills, and both are important in their own ways. But before I get into communication, I also realize that I need a better understanding of the patients that I'm working with, their background. So in a TED Talk that Sir Harry Burns did on what causes wellness, he talked about, he's a doctor, and he talked about patients that he was looking at, comparing within hospitals or something along that nature, and the patients that were having healing slower times actually had other stressors in their life, such as low socioeconomic status, family problems, the way they were simply raised, their childhood experience, and that stress in their life caused a slower healing process. The patients had a different outlook on their injury or illness, on the outcomes, so on and so forth. So, when I look at the patients that I'm working with, I need to keep in mind, okay, what are the stressors within this patient's life? What are the stressors I may already know of, such as socioeconomic status, race, age is a big one, comparing, the older population to all the way to children. There's a big difference in how I'm going to communicate with those people. Looking at behavioral cognitive issues, especially with me working in a high school setting, childhood experiences, personal connections. Do they have a support system? Do they not? And the list goes on. their literacy abilities, and how they're going to be able to interpret and take or interpret you know, are they even going to be able to, understand how am I verbally speaking to them in a way that they can understand everything that I'm saying, and how am I going to make sure that they remember what we just talked about? So I was kind of overwhelmed by the factors and made me really think about. I took it personally, made me really think about what I do on a daily basis, and how I communicate. And I know for sure that I don't consider all these factors. So then with that, I looked into how to better patient communication with this consideration of all these factors. So for instance, take age into perspective. If I were to be talking to an older patient, or have closer follow-up care with older individuals that may be have limited health literacy, which could set them up for greater risk for worse clinical outcomes. And there's statistics on population or gender differences and so on and so forth. But anyways, so that's one way to better the communication. If I were just to be giving out handouts, think about the design of the handout. Is there space for the patient to add notes or document measurements or maybe how they're feeling? What's the font? Is the font simple? Is the design simple? What are the words like? Are they complicated, medical terms, or are they simple to understand? Simple enough that the patient can turn around and explain it to the next person that they're standing by. Critical information needs to come first, both in verbal and in written, because that's what they're going to take away first. And if you're going to write down that kind of information, make sure that is at the top of the paper, the handout. Make sure it's bolded. There's so many ways to improve communication, and I really enjoyed reading about them. So there are a lot of other points I could be making, but overall, I truly enjoyed learning more about the connections between health literacy, patient factors, and communication.